So today's topic is Talu Rogas. You all know Talu region, right? In Ayurveda we call Talu, and in modern they will call that as palate. So behind the upper teeth there comes the palate. In front it is hard palate and behind it is soft palate. And there is a midline between this palatal plate that you can feel, right? So hope you all know the anatomy of palate. We will start with the diseases which is affecting this Talu region. So the disease that is affecting our palates. So Talu Rogas. First we will see the enumeration of Talu Rogas. According to Ashtanga Kritya, there are 8 Talu Rogas, and according to Susruta Samhita, there is 9 Talu Rogas. So Ashtanga Kritya, the 8 Talu Rogas are Talu PIDIKA, GALASHUNDIKA, Talu SAMHATI, Talu ARBUDA, KACHAPA Talu, Talu PUPPUDA, Talu PAKA and Talu SHOSHA. And in Susruta Samhita, there are 9 Talu Rogas. That is TUNDIKERI, GALASHUNDIKA, Mamsa Sankada, Talu ARBUDA, KACHAPA Talu, Talu PUPPUDA, Talu PAKA, Talu SHOSHA and ADRUSHA. So you can see the difference. I highlighted that with the red color. So in Ashtanga Kritya, Talu PIDIKA is mentioned, which is not mentioned by Susruta Samhita, and in Susruta Samhita the other 2 extra diseases mentioned are Tundikeri and ADRUSHA. Tundikeri is mentioned in Ashtanga Kritya under Kandha Rogas, not in Talu Rogas, but in Susruta Samhita Tundikeri is mentioned under Talu Rogas. So these are the enumeration of Talu Rogas. So according to Ashtanga Kritya there are 8 Talu Rogas, and according to Susruta Samhita there are 9 Talu Rogas. In Ashtanga Kritya the extra disease is Talu PIDIKA, and in Susruta Samhita Tundikeri and ADRUSHA is mentioned, and Tundikeri is mentioned in Ashtanga Kritya under Kanda Rogas. So the diseases are Talu PIDIKA, GALASHUNDIKA, Talu SAMHATI, Talu ARBUDA, KACHAPA Talu, Talu PUPPUDA, Talu PAKA and Talu SHOSHA. And according to Susruta Samhita, they are same. GALASHUNDIKA and Talu SAMHATI is called as Mamsa Sankada according to Susruta Acharya. So only that is the difference. The name Talu SAMHATI is in Ashtanga Kritya, and in Susruta Samhita, Susruta Acharya called it as Talu Sankada. Hope you all understood the enumeration of Talu Roga. According to Ashtanga Kritya it is 8, and according to Susruta Samhita it is 9. Talu PIDIKA is mentioned extra in Ashtanga Kritya, and ADRUSHA is mentioned extra in Susruta Samhita, but this Tundikeri is mentioned in Ashtanga Kritya in Kandha Rogas. So the first disease mentioned in Ashtanga Kritya is Talu PIDIKA. Talu Mamse Anila Dushte PIDIKAha Sarujaha Kharaha Bahwayo Khana Srava Yudas Tas Talu PIDIKA Smrdaha. Talu Mamse Anila Dushte PIDIKAha Sa Ruchaha Kharaha Bahwayo Khana Srava Yudas Tas Talu PIDIKA Smrdaha. So where it is affecting? It is affecting in Talu Mamsa. In the Talu region, in the Mamsa, it is getting affected. Which dosha is vitiating here? Anilad. Talu Mamse Anilad Dushte PIDIKAha. So what will form there? PIDIKAs will form there. Small PIDIKAs will be forming. Sarujaha, along with pain. There will be pain in the PIDIKAs. Khara, that will be rough. Bahwayo, so there is more in number, multiple number PIDIKA can be seen. Khana, it will be thick. and Sravayuda, and there will be Srava, discharge coming out from this Pidikas. Tas Talu Pidika Smrataha, that is known as Talu Pidika. So Talu Mamsa will get vitiated by Anila, and it will lead to the formation of Pidika. That Pidika will be having Ruja, pain will be there, and it will be rough, and there will be more numbers, and it is thick, khanaha, and discharge will be coming out from those pidika. Those pidikas are known as Talu Pidika. So these are the multiple cysts that can be seen in the palatal region. So this can be compared with Talu Pidika. So Talu Mamsa is getting affected, and here the vitiation of Vada dosha is happening, and Pidikas are forming along with pain, and it will be hard, rough, and also there will be more in numbers, and Srava discharge will be coming out from these Pidikas, and these are known as Talu Pidika. So these are asadhya vyadis. So Acharya Vakbada is not mentioning any treatment for that. So next disease is Galashundika. So in Galashundika, Talumule Kafatsa Asrad, Malsya Basti Nipho Mrudu, Pralamba Pichila Shofo, Nasaya Aharam Irayan, Kandha Ubaroda Tritkasa Vamikrit Galashundika. Talumule Kafatsa Asrad. So in Talumula, this disease is happening. So it is mentioned both in Ashtanga Hridaya and Susura Samhita. So Talumule Kafatsa Asrad. So here both kapha and recta is getting vitiated. Malsya Basti Nipho Mridu Pralamba Pichila Shofaha. So what is happening? There is shofa or swelling is forming, which looks like Malsya Basti Nipho. It looks like the bladder of fish. Malsya Basti Nipho Mridu, soft, Pralambaha, long, elongated, Pralambaha, Pichila means slimy, chofo. That type of swelling is forming, and what all disturbance or symptoms the patient will feel. Nasayam aharam irayan. What he is having is started coming out through the nose. Kanda ubaroda. There will be obstruction in the throat region, and thirst will be there. Kasa vamikrit, cough will be there, and vomiting will be there. And that disease is known as Galashundika. So this is happening in Talu Moolam, the end of the Talu it is happening. It is because of the vitiation of kapha and recta, and you can see a swelling here, right? That is the swelling that looks like Malsya Basti Nipho, the bladder of fish, and also it is elongated, it's slimy, and it's a swelling. And if you are having food, that will come out through the nasa, and there will be obstruction in the throat. Maybe because of that the ahara is coming out through nasa, and there will be thrid, kasa, and vami. There will be vomiting. This disease is known as Galashundika, and this condition is uvulitis. This is a picture of a patient having uvula, you know, right? This structure, uvulitis. Till here normally it will come because of the infection or inflammation. It become elongated, and there is a swelling, and it resembles the basti of a fish. So they are known as Galashundika. This is according to Ashtanga Hridaya. Coming to Susra Samhita, Sileshma Asrutpyam Talu Moolat Pravruto Dirkhaha Shofot Mada Basti Prakashaha Trishna Kasa Shwasa Kris Sampradishto Vyadar Vaidyo Kandashundir Iti Namna. Here Acharya is calling it not as Galashundi, he is calling it as Kandashundi. So both are same. Kandashundi or Galashundika are same. So, Sleshma Asrikhyam Talu Moolat Pravrto Dirkaha Shofot Mada Basti Prakashaha, same as Ashtanga Hridaya. Here also the vitiated dosha is Sleshma and Asrik, and it is happening in Talu Moola, in the root of Talu, and Dirkaha Shofa. It will cause a elongated the swelling. Mada Basti Prakasho, it resembles the bladder, inflated bladder. So it looks like a swollen bladder. There will be other symptoms are Trishna, Kasam, Shwasam. Trishna, Kasa and Shwasa will be there, and that Vyadi is known as Kanda Shundir iti Namna. So here also Sleshma Asripyam. This is caused by the visheshan of Kapha and Rekta, and it is happening in the Talu Mula, that is, you saw in that picture, right? In the uvula, there will be inflammation of the uvula, and it will cause a elongated swelling. There will be pichila, sliminess will be there, and it looks like a malsebasti, and other symptoms are Trishna, Kasam, Trid, Kasam, Shwasam, and in Ashtanga Hridaya, along with that Vamana, Vami is also, Vamikrit is also mentioned, and also Nasayam, Aharam, Iren. So from through the nose, the food will come out. So that is the Lakshana of Galashundika. We'll see the treatment. Kafaknaihi Shundika Sadhya Nasya Gandusha Dharanaihi. So in Shundika we have to give Kafakna. Kafakna what? Kafakna Nasya and Kafakna Gandusha. So Shundika is a Sadhya Vyadi, and we can give Nasya and Gandusha using Kafakna drugs. So Kafaknaihi Shundika Sadhya Nasya Gandusha Karshanaihi. So Nasya can be given, Gandusha can be given, Karshana, rubbing or Pradisarana can be given using Kapakna Dravyas. This is the treatment mentioned in Ashtanga Hridaya. Ervaru Bija Pradima Vrithyayama Asira Tadam Agram Nivishta Jihvayam Bedishad Avalambidam Chedayed Mandalagrena Na Atyagre Nacha Mulataha Chede Atyasrik Shayan Mrityur Hine Vyadi Vivardade. So Ervaru Buija Pradimam Vrithyayama Asira Tatham Agram Nivishta Jihvayam Bedishayam Avalambidam Chedayed Mandalagrena Na Atyagre Nacha Mulataha Chede Atyasri Kshayad Mrityur Hine Vyadir Vivardade. So Ervaru Bija Pratima. Ervaru Bija means what? Cucumber seed, right? If it is like a cucumber seed, Vrithyayamam. So it is big enough. Asira Tatham. There is no siras in that. Agram Nivishta Jihvayam. Nivishta Jihvayam means if that is touching the tongue, the upper portion of the tongue. Normally it won't, right? Uvula won't touch the upper portion of the tongue, but if it is touching the upper portion of the tongue, then we can go for Shastra Karma. So Agram Bedishena Avalambidam. So with the Bedisha Yandra, we can hold the tip of this Talu Mula, Chedayed Mandalagrena, and you can cut using Mandalagra, Na Atyagre, Na Chamulataha, not in the tip, not in the root area. So in between you have to cut. Chedayed Mandalagrena, Na Atyagram, Na Chamulataha, Chede Atyasrik Shayad Mrityu, Cheded Adi, Cheda, if you are doing Cheda, Asrik Shayad, because of the hemorrhage, Mrityu can happen. Hine, if it is less, then Vyadir Vivardade, then there will be increase in disease. So if you are cutting more, then there will be hemorrhage and the patient will die. If you are doing it less, the disease will reoccur. So this is the treatment according to Ashtanga Hridaya. So first Acharya is mentioning you can give Kafakna, Gandusham, Nasyam and Karshana. And if it is on the size of, it looks like Ervaru Bija, and if it is big and without siras, Asiram, Tatham, you can, and it is touching the Jihva, then you can hold the this Talamula or this Galashundika using Vedisha Yantra, and you can do Chedana with Mandalagra Shastra. And it should not be on the end or should not be in the root, it should be in the middle. And Chedayed Atyasrik, if you are doing Adicheda, then it will cause more loss of blood and it will lead to Mrityu. The patient will die. If you are doing Hina, if you are doing it is very less, then the other Vivardade, it will cause the increase of disease. So this is the treatment according to Ashtanga Hridaya. After cutting this, what can be done? That is mentioned next. Marija, Adivisha, Pada, Vaja, Kushta, Kudannadehi, Chinnaya, Sapaduk, Shaudrer, Karshanam, Kabalaha, Punaha, Kaduka, Adivisha, Pada, Nimba, Rasna, Vaja, Ambubihi. So you can go for Karshana, Pradisarana and Kabala. Pradisarana or Karshana can be done with Marija, Adivisha, Pada, Vaja, Kushta and Kudannada, Chinnaya, Sapadu, Kshaudra, Karshanam. You can mix that with the powder of this Chinnaya. This powder of this can be taken along with that Padu, Saindava and Shaudra can be mixed and you can go for Karshana. And Kabala Punaha, Kabala can be done using the Kashaya prepared with Kaduga, Adivisha, Pada, Nimba, Rasna and Vaja, Ambubihi. So the Ambu prepared with the Kashaya prepared with the Kaduga, Adivisha, Pada, Nimba, Rasna and Vaja can be used for Kabala. So first you can go for Chedana. After Chedana you can do this one, Marija, this Karshana can be done using Marija, Adivisha, Pada, Vaja, Kushta and Kudannada along with Saindava and Kshaudra, and Kabala can be given using the Kvada prepared with Kaduka, Adivisha, Pada, Nimba, Rasna and Vaja. So next comes the treatment mentioned in Susra Samhita. Angushta Anguli Samdamshena Akrishya Galashundikam Chedayed Mandalagrena Jihva Ubaristu Samstidam Na Utkrishtam Cha Eva Hinam Cha Tribhagam Chedayed Bhikshak Atyayadanat Sraved Dektam Tan Nimittam Mriyade Cha Hina Chedat Bhaved Shofo Lala Nidra Pramastamaha Tasmad Vaidyaha Prayatnena Drishta Karma Visharadaha Galashundintu Sanchidya Kuriyat Praptam Imam Kramam Angushta Anguli Samdamshena Akrishya Galashundikam Angushta Anguli Samdamshena Akrishya Galashundikam. Galashundika can be hold using Angushta Anguli or Samdamsha Yantra. You can hold with this Chedayed Mandalagrena. After that you can do Chedana using Mandalagra, Jihva Ubaritu Samstidam. That will be on the top of the Jihva. Na Utkrishta, no Utkrishtam cha evam Hinam cha Tribhagam Chedayed Pirshak. So it should not be more, na Utkrishtam cha eva Hinam. Not be less and not be more, and it should be in the Tribhagam. The Tribhaga can be done, cutting should be done at the 1/3 part, and at Tribhagam, it should not be more and it should not be less, and Tribhaga can be cut. Atyayadanat Sraved Rektam. If you are doing it more, then there will be more bleeding. Tan Nimittam Mriyadescha. Because of that, it will lead to death. And Hinex Chedat Bhavet Shofam. So if it is cut less, then in Ashtanga it is mentioned Vyadar Vivardade. Here it is mentioning there will be Shofa, the Lala, there will be salivation, the Nidra will be the Pramaha, there will be Prama, Tamaha, and Tasmad Vaidyaha Prayatnena Drishti Karma Visharadaha. So the patient, the Vaidya, the good physician should avoid all these things, and you have to do the after procedure. Galashundintu Sanchidya Kuriyat Praptam Imam Kramat. So the remaining, the after procedure should be done. So, how the same as in Ashtanga Hridaya, here also in Susura Samhita, Acharya is mentioning the surgery, Shastra Karma. So, Angushta, Anguli, Samda, Angushta and Anguli. You have to hold the Galashundi between the thumb and the index finger, or using the Samdamsha Indra, using forceps. You have to hold the Galashundika and you have to cut using Chedayed Mandalagrena. Jihva Upari Samstidam, which is touching the Jihva. You have to do cutting using Mandalagra Shastra. Na utkrishtam cha eva hinam cha. It should not be on the end, it should not be near the root. That is what mentioned in Ashtanga Hridaya. Here also, not more, not less. Na utkrishtam cha eva hinam cha. Tribhagam. The 1/3 you have to cut. And Atyayadana, if you are cutting more, then it will cause Sraved Rekta, more hemorrhage will be there and it will leads to death. And Hinas Chedat Bhaveda. If it is, you are cutting it less, then it will lead to show from Lalasravam, Nidra, more sleep, Prama, and giddiness, Tamaha, and there will be dark blackouts. And Tasmat Vaidya should put effort to should not come to this level. So carefully we have to do this surgery. And Galashundin to Sanchidya Kuryat, after Sanchidya, after Chedana, Praptam Imam Kramam. So the remaining procedure should be, the post procedure should be done. We'll see what is the post procedure. So after that you have to go for Pradisaranam. Marija Adivisha Pada Vacha Kushta Kudandadehi Chaudre Yuktersa Levane Tadastam Pradisaraye. Vajam Adivisham Padam Rasnam Kaduka Rohini Nishkwadya Piju Mandamcha Kapalam Tatra Yojaye. So this is Kapala Yoga and this is Pradisarana Yoga. Ingudi Kinihi Dandi Sarala Suradarubihi Panchangim Karayir Prishter Vartim Gandha Uttaram Shubham Tado Dhumam Pibet Jandur Dvirachna Kafanashanam Shara Siddheshu Mudgeshu Yushascha Apyashane Khidaha. So after doing Chedana, you can go for Pradisarana using Marija, Adivisha, Pada, Vaja, Kushta and Kudanada. You have to mix with Lavana and Shaudra and do Pradisaranam. Then you can go for Kapala. Kapala can be done with Vaja, Adivisha, Pada, Rasna, Kaduka Rohini. You can do Kashaya using this and you can go for Kapala. And you have to make Panjagnim. Panjagnim can be made with Ingudi, Kinihi, Dandi, Sarala, Suradaru. That is Panchangi. So that you have to make. And Gandha Uttaram, nice smell. The fragrance is good. That is Gandha Uttaram Shubham. So Varti you have to make with all these things. And this Duma can be given. So Tato Dumam Pibed Jandur Dvirachnaha. So 2 times a day you can give this Duma for Kapha Nashanam. So Shara Siddheshu Mudgeshu Yushascha Apyashane Hidaha. And you can give Yusha prepared with Mudga. Along with that you have to add Eva Sharam. So this is the after procedures of Galashundika Chedam. So after the Chedana, you can do Pradisarana with Marijadi Yoga, and you have to go for Kapala using Vaja Adivisha Padarasana and extra Kabahara Varti, Duma Varti is mentioned here, that is Panchangim. So Panchangi is made with Ingudi, Kinihi, Gandhi, Sarala and Suradaru Bihi, and this can be given for Dhumapana twice a day. So Kafanashana, Dhumapana, and also we can advise the patient to have Yusha prepared with Mudga added with Shara. So this is the treatment of Galashundi. So hope you all understood the Lakshana and the treatment of Galashundika. Next comes the next disease is Talu Samhati. Talu Samhati or Mamsa Sankada. So Talu Madhye Niruk Mamsam Samhadam Talu Samhati. So Talu Madhye Niruk Mamsam in the middle of the talu, there will be a group of mamsam. So talu madhye niruk mamsam samhadam. So a group of mamsa. So there is a group of mamsa which as niruk, there is no pain, and that is known as talu samhati. So talu madhye niruk mamsam samhadam talu samhati. So in Susra Samhita also, dushtam mamsam sleshmana nirujam cha talu andastam mamsa sangada mahu. Dushtam mamsam, the vitiated mamsa, because of what it is getting, because of vitiated sleshma, the mamsa will get vitiated, and there will be talu andastam, the inner part of the talu, there will be a mamsa. Mamsa Sankhatam, the mamsa will be, the vitiated mamsa will be forming, and it is nirujam, there won't be any pain. That type of mamsa is known as talu samhati, and the talu samhati can be compared with adenoma or fibroma of palate. So dushtam mamsam, the sleshma, the sleshma getting vitiated will vitiate the mamsa on the talu pradesha or under talu and causes the samhadam. This vitiated mamsa can be seen as a group on the talu madhya or talu andastam. That disease is known as talu samhati. So you can see here, right, the mamsa is getting crowded in one place. It's grouped in one place. This is because of the vitiated mamsa, and also in Susra Samhita it is mentioning as it is happening because of the vitiation of sleshma, kapha getting vitiated and causing the vitiation of mamsa, and it is coming and forming a mass on the talu region, talu madhya, or on the talu andaha, in the inner part of the talu. It is forming this this crowding of mamsa. Dushta mamsa can be seen, and this is known as talu samhada or mamsa sanghada according to Susra Samhita. The treatment of all the remaining diseases are mentioning together. So first I will go through the lakshanas, then we will see the treatment. So that is talu samhati or mamsa sanghada. Next comes the talu arbuda. So it is like all other arbuda. So Padmagridir talu madhye rektat kshayadur arbudam. So here who is causing arbuda? Rekta dosha getting vitiating and causing arbuda in talu madhya, in the madhya talu, and it looks like Padmagridi, it looks like a lotus, the color, and it resembles the lotus, that is talu arbuda. So it is mentioned both in Ashtanga Hridaya and in Susra Samhita. Padmakaram talu madhye tu shobham vidyat rektat arbudam proktalingam. So here also Padmakaram, it looks like a Padma, lotus, talu madhye, where it is seen in talu madhya. And what is that? That is a shobham. Vidyat rektat. So who is making this one? Rekta is getting vitiated and making this one arbudam proktam. So we'll call that as talu arbudam. So Padmagridir talu madhye rektakshvayadur arbudam. That is according to Ashtanga Hridaya, and according to Susra Samhita, Padmakaram talu madhye tu shobham vidyat rektat arbudam proktalingam. Both are telling the same. So vitiated rekta is causing this, and it is you can see this disease in talu madhya, and it resembles the Padmagridi, it resembles the lotus. This disease is known as talu arbuda, and we can compare this with epithelioma or cancer of the palate. So talu arbudam. So it Padmagridi, it looks like a lotus, and it can be seen in the talu madhya region, and it is caused by rekta, and this is known as talu arbuda. It is mentioned in both Ashtanga Hridaya and Susra Samhita. Next comes Kachapa talu. So from the name itself you can understand Kachapa. Kachapa is turtle or tortoise. So Kachapaha, Kachapakara Chiravruddhihi Kafag Aruk. So Kachapaha, Kachapa talu is Kachapagara. It resembles the shape of Kachapa. That means it resembles the shape of tortoise or turtle. Chida vrittihi, and it will take time, like a lot, tortoise only, it will take a long time to become paga. Chida vrittihi, for increasing the size. Kafad aruk, it is caused by kapha dosha and there won't be any pain. Aruk. So that is Kachapa Talu. Susra Samhita also same. Kurma Utsanno. So like a tortoise. So Kurma Utsanno, like how a tortoise is, like that it is, the swelling is like that. Avedano, there won't be any pain. Ashikra Janmam, it is taking a long time to become that size. Arekto, there won't be any redness. Nyeya Kachapa Sleshmana Syat, that is because of the visheshan of Sleshma, Kapha dosha. That disease is known as Kachapa. So Kachapa Talu. So the swelling looks like a tortoise or a turtle, that is known as Kachapa Talu, and Kachapa Talu can be compared with adenoma. This is an adenoma of a palate. So Kachapagara, so it resembles a tortoise or a turtle, and Chida Vrittihi, it will take time to become for growing. Chida Vrittihi, slowly only it will grow, and it is caused by kapha, and there won't be any pain. So Aruk, so that is Kachapa Talu. Same only mentioned in Susra Samhita also. Kurma Utsannaha, it is raised like a kurma, like a tortoise. Avedano, there won't be any pain. Ashikra Janmam, it is not fast, it is very slow growing growth. Arekto, there won't be any recta. Nyeyaha, there won't be any visheshan of recta, or there won't be any redness. Nyeyaha Kachapaha, that disease is known as Kachapa, and it is because of the visheshan of Sleshma. So that is Kachapa Talu. Next comes Talu Puppuda. As I mentioned, all the treatment will be mentioned together in the last. Talu Puppuda. Kolapaha Sleshma Medopyam Puppudo Nirujaha Stiraha. Kolapaha. So Kola Matra, you know, right? Kola seed is like Lenda seed. Kolapaha. So that much only it will be Sleshma Medopyam. So here there will be visheshan of Sleshma and Medas Puppudo, that is known as Puppuda. Nirujaha Stiraha, there won't be any pain and it will be Stira. So that will be, it won't move, that is Stira. So Kolabaha Sleshma Medopyam Puppudo Nirujaha Stira. So you saw, right, there are a lot of swelling. Talu Rogas are, there are a lot of swelling, but mainly it is without any pain, and there is Stira. So we can compare all of this with a fibroma, adenoma, or cystic swelling, this type of swelling only. So Talu Puppuda, so Kola Baha, the size is size resembles the size of Lenda Kola, and it is because of, it is forming because of Sleshma and visheshan of Sleshma and Medas, and the swelling is Stira, and there won't be any pain. Nirujaha, so that is known as Talu Puppuda. Niruk stai kola matraha kafad syat medo yuktan puppudas talu deshe. So there will be a swelling. Niruk, without any pain. Stai, it is in one place, it won't move. Kola matram, the size resembles the seed of Lenda, and it is caused by kapha and Medas. That disease is known as Talu Puppuda. Same as Ashtanga Hridaya. The Ashtanga Hridaya and Susra Samhita is telling the same explanation only. Kola Matram and Visheted doshas are Sleshma and Medas, and it will be Stira and Nirujaha. There won't be any pain. That is known as Talu Puppuda, and you can compare this with fibroma or any cystic swelling of the palate. So you can see here the fibroma or a cystic swelling. You can see in the Talu region. This is known as Talu PUPPUDA. So Talu PUPPUDA, Kola Matra, Lenda size, and it is Niruka. The pain won't be there. That disease is known as Talu. So, as I mentioned, the treatments are mentioned together. Sankhade, Puppude, Kurme, Vilikhevam Samachare. This is according to Ashtanga Hridaya. So, for Mamsa Sankhada, Talu Samhati, Talu Puppuda, Kachapa Talu, we can go for Vilikhevam, Lekhana Samachare. So, Lekhana can be given, and after that you can follow the treatment mentioned for Galashundika. So after Galashundika treatment, this is mentioning. So Sankade, Puppude, Kurme, Vilikhevam. First you have to go for Lekhana. Lekhana can be given, and after that you can go for the Galashundika. If it is long and big growth, then you can go for Chedana. Otherwise, the Pradisarana, Gandusha, Nasya, Karshana, all those things, Kafakna, Gandusha, Karshana, Nasya is mentioned for Galashundika Chilsa, right? So that you can take here also. So in Sanghada, Puppuda, Kurma, Lekhana can be done. After that, Pradisarana or Nasya or Gandusha can be given. So this is the treatment according to Ashtanga Hridaya. Talu, next disease is Talu Paga. So in Talu Paga, Pittena Pagaha Pagakya Puyasravi Maharujaha. So here the Talu Paga is because of Paga. So you all know, right, which dosha will be vitiated? Pitta. So Pittena Pagaha. Pitta will cause Paga, Pagakya. Talu Paga will occur. Puyasravi Maharujaha. There will be Puyasravam. Pus discharge will be there. Maharujaha. Severe pain and pus discharge is seen in Talu Paga. So Pitta getting vitiated, causing Talu Paga. There will be Puyasravam and there will be Maharujaha. So Pittam Kuriyad Pagam Atyartham Koram Talunyenam Talupagam Vadanti. So Pittam Kuriyad Pagam Atyartham Koram. So Pitta is causing Paga, Atyartham Koram. There will be severe pain where Talunyenam, it is causing severe pain in Talu region, and that is known as Talupagam. Talupagam Vadanti. So Talupaga is formed because of the vitiation of Pitta, and there will be Puyasrava, pus discharge will be there, and there will be severe pain also. This can be compared to any ulceration in the palate. So ulcers of the palate can be compared with Talupaga. So it is caused by Pitta, and there will be Paga, and there will be Puya discharge coming from that, and severe pain will be there. So that is Talu Pagam. So treatment for Talu Pagam. Apakve Talu Page tu Kasisak Shaudra Tarshajaihi Karshanam Kabala Shida Kashaya Madura Aushadaihi. So Apakve Talu Page. So if the Talu Paga is not Pakwa, it didn't reach the Pakwa stage, then you can go for Karshanam, Pradisaranam with a Kasisam, Shaudram and Tarshyam. Kasisak Shaudra Tarshehi Karshanam. And you can give Kabala using Shida, Kashaya, Madura, Aushadam. So using Shida Dravyas or Kashaya Dravyas or Kashaya or Madura Aushada, you can go for Kabala. So in the Apakwa stage, you can give Karshanam using Kasisak, Shaudra and Tarshya, and you can go for Kabala using Shida Kashaya or Madura Rasa Aushadas. Pakve Ashtapadavat Pinne Tishnoshnehi Pradisaranam Vrisha Nimba Padolhadi Tiktehi Kapaladaranam. Pakve, it is in the Pakwa stage now. Then you have to do Pinna, Pedana. How? Ashta Padavad. So Ashta, 8 legs. So you have to do 8 legs. Ashta Pada Pinnam, Pedana. After that you have to apply Tishna Aushada, Pradisaranam. So after doing this Vedanam, Ashtapada Vedanam, 8-leg Vedanam, you can do Pradisarana using Tishna, Ushna, Aushadas, and also Kabala. Kabala can be done using Vrisha, Nimba, Padoladya, Tiktehi, Kabala Dharanam. Kashaya prepared with a Vrisha, this Tiktarasa Dravyas, Vrisha, Nimba, Padola, and using that you have to do Kabala also. So Acharya is mentioning the treatment in both the stages, in Apakwa stage and in Pakwa stage. In Apakwa stage, you have to go for Karshanam using Kasisa, Kshaudra and Tarshyam, and you can go for Kabala using Shida Kashaya or Madura Kashaya Dravya. So that Shamana will occur in Apakwa stage. If it becomes Pakwa, then you have to go for Vedanam. Vedana you have to do in Ashtapada Vedanam, and in Ashtapada Vedana, after doing that you have to do Pradisarana using Tishna Ushna Dravyas, and then you can go for Kabala Dharana using this Nimba Padola and Tikta Rasa predominant medicine. You can go for Kabala Dharana. So this is the treatment for Talu Pakam. So Talu Paka is ulcers on the Talu. And according to Susra Samhita, Talu Page to Kartavyam Vidhanam Pitta Nashanam. So it is a Pitta vitiated disease, so you have to go for Pitta Nashana Chikilsa. Pitta Kina Chikilsa can be given in Talu Paka according to Susra Samhita. The last disease according to Ashtanga is Talu Shosha. So Shosha you know, right? So atrophy of palate, that is Talu Shosha. Vada Pitta Jwara Ayaser Talu Shosham Tadahvayam. So here Vada and Pitta will get vitiated, otherwise because of Jwara or Ayasa exertion also there will be Talu Shosham. So Talu Shosha can be formed because of the vitiation of Vada and Pitta, or because of Jwara, or because of Ayasa. You will get Talu Shosham Tadahvayam. So Vada Pitta Jwara Ayase Talu Shosham Tadahvayam. Shosho Atyartham Diryadescha Api Talu Shoso Vada Talu Shosha Sapittat. Here also Pitta is causing Shosham. Atyartham Shosham. So more Shosha atrophy will be there. Diyade Cha Abhi Taluhu. In Talu there will be more Shosham, and that will cause Shwasam. Shwasa will be there, difficulty in breathing. Vada Talu Shoshaha Sapittat. Vada and Pitta is causing Talu Shosham. So Atyartham Shoshada will be there in Talu region, and there will be, because of that there will be Shwasam, difficulty in breathing, and it is caused by Vada and Pitta, and that disease is known as Talu Shosham. So there will be Shosha, the atrophy will be there, dryness will be there, and emaciation, that is Shosham. Shoshada will be atrophy of the Talu will be there. So Talu Shosha is combined with atrophy of palate. Treatment. Talu Shoshe tu Trishnasya Sarpir Uttara Bhaktikam Kalashundika Srutam Panam Amlair Gandusha Dharanam. So in Talu Shosha tu Trishnasya, along with Trishna, if the patient is complaining Talu Shosha with Trishna, Trishnasya Sarpir Uttara Bhaktikam. Sarpir, first you have to give Sarpir Panam, Uttara Bhaktikam. After that Uttaram you have to take food. So before food you have to do Sarpir Panam. So Sarpir Uttara Bhaktikam. Kana Shundi Sridam Panam. You can drink water boiled with Kana and Shundi. Ganda Amlehi Gandusha Dharanam. Using Amla Dravyas you have to do Gandusham, holding the liquid inside the mouth. And also you can go for Dhanva Mamsa Rasaha Snigdha, Snehana using Dhanva Mamsa Rasa, and Shira Sarpasya Navanam. Nasya can be done using Shira Sarpihi, Sarpir, that Krida getting from Shira. So from the cream of the milk you can take Krida. So using that you have to do Nasya. So this is the treatment for Talu Shosha. So in Talu Shosha tu Trishnasya Sarpir Uttara Bhaktikam. So Sarpir can be given first, then after that you have to take food. Kanashundi Sridam, Pippali Shundipyam Sridam Jalapanam. So Panam, Jalapanam with the water boiled with the Pippali and Shundi. Amla Gandusha Dharanaihi, Amlaha Kanchi Kadipihi. So Amla Drivya you can use for Gandusha Dharana, and Danva Mamsa Rasa Snigda. So Snehana can be done with the Danva Mamsa Rasa mixed with the Sneha can be given, and Shira Sarpishta Navanam. Nasya using Shirasya Sarpishta Navanam Hitam. So Nasya using Shira Sarpihi, Krida taken from the milk can be used. So this is the treatment for Talu Shosha. According to Susra Samhita, the Talu Shosha treatment is Sneha Svedo Talu Shosho. In Talu Shosha, you have to go for Snehana and Svedana, Vidisha Anila Nashanaha, and Vadahara Dravyas can be given. Vidisha Anila Nashanaha. So Vadahara Chikitsa can be given. So Snehana and Svedana and Vadahara Dravyas can be given. Kirtidam Talu Janam. So like that. Talu-Gata diseases are over. The treatment for all the Talu-Gata diseases are over according to Susra Samhita. Okay. So Sneha Sweda can be given, Snehana and Swedana, and also Vadahara treatment should be given in Talu Shosha according to Susruta Samhita. Next comes this till here is according to Ashtanga Hridaya, and the two extra diseases mentioned in Susra Samhita is Tundikeri and Adrusha. So Tundikeri, Shofaha Stula Stoda Daha Prabagi Prag Uktapyam Tundikeri Madatu. So there will be Shofa, Stula Shofa, weak Shofa, there will be Todam, Daham and Prabhagam, Prag Uktapyam. Prag Uktapyam means before Tundikeri in Susra Samhita, Acharya is mentioning Galashundika. So Galashundika is formed by the vitiation of Kapha and Rekta. So Prag Uktapyam. So in Tundikeri also there will be vitiation of Kapha and Rekta. So Tundikeri Madatu, that is known as Tundikeri. So because of the vitiation of Kapha and Rekta, there will be formation of a big swelling, that is Shofaha Stula, and along with that there will be Toda, Daha and Paga. So Toda, Daha and Paga. Pain will be there, burning sensation will be there, and Paga, suppuration will also be there. That disease is known as Tundikeri, Tundikeri Madatu. So there will be a swelling, and that will be a big swelling stula, Toda, Daha and Prapaka, and Praguktapyam, who is causing that Rekta and Sleshma and Rekta, which is the same as Galashundika. That disease is known as Tundikeri, and this disease is mentioned under Kanda Roga in Ashtanga Hridaya, but it is mentioned under Talu-Gata Rogas in Susruta Samhita. So I am mentioning it here. So it is compared to tonsillitis. Adrusha. Adrusha, Shofaha Stabdo Lohida Talu Deshe Rektatnyeyaha. So Adrushu Rukjwaratyaha. So Shofaha Stabdaha Stabdo Lohida Talu Deshe Rektatnyeyaha. So Adrusha Rukjwaratyaha. So it is a disease caused by the vitiation of Rekta, Rektatnyeyaha. Here also Shofa will be there, swelling, Stabdo, stiff swelling will be there. Its color is red. Lohida, where it is in Talu Desha. So in all the Talu Desha there will be a swelling. There will be edema in full Talu Desham, and the Talu will become red in color, and it is caused by Rekta, and it is known as Adrusha Rukjwara Atyam, and there will be pain and there will be fever also. So Rukjwara Atyam, that disease is known as Adrusha. So Adrusha, there is a full swelling over the Talu Desha. So in the palate region there will be full swelling, Shofam, Stabdo, stiff swelling, and it is red in color. That Talu Desha is red in color. There will be pain and there will be fever. That disease is known as Adrusha, and we can compare that with palatitis. So the inflammation of full palate, that is Adrusha. And the treatment for Tundikeri and Adrusha, Tundikeriya Adrushe कूर्मे संघाते तालु पुप्पुडे एष एव विधिं कार्यो विशेषः शस्त्रकर्मणि. So Susradacharya is mentioning all the disease here together, right? Tundikeri, Adrusham, Kurmam, Kachapam, Mamsa Sangadam and Talu Puppude. Esha eva vidhi, that means the Galashundika treatment only should be given here also. Karyo Visheshana Shastra Karmani. So Visheshana Shastra Sadhya. All these are Shastra Sadhya Vyadis. So in Galashundika, what all treatment is mentioned, you can follow that only in Tundikeri, Adrusha, Kachapa, Sankada and Talu Puppuda. This is the treatment according to Susra Samhita. And that's about the Talu Rogas according to Ashtanga and Susra Samhita. Hope you all understood the Lakshanas and treatment and enumeration of these Talu Rogas. Thank you.